If you're a runner, a dancer, or maybe you're in the military, chances are you felt that awful, sharp pain right along your shin bone. You know the one. It's so easy to just write it off as part of being active, but what is the evidence actually telling us? Today, we're going to dig into the data behind this super common injury and build a clear, evidence-based guide to shin splints.
So, let's jump right in with our first piece of data, and it comes from a really fascinating, kind of counterintuitive question someone posted on Reddit. They said they only started getting shin pain after they bought expensive, quote-unquote, proper running shoes. I mean, how does that even happen? Let's treat this little mystery as the central puzzle we're going to try to solve today with data.
And that leads us right to our first big question. What is the real culprit behind this pain? Is it actually our equipment? Is it how we're training? Or is it something else entirely? Let's start investigating the variables. Right off the bat, we see this isn't just a runner's problem. Not at all. This specific kind of leg pain is a widespread issue across a whole bunch of high-impact activities. And this isn't just a feeling. The numbers show its prevalence across these groups is statistically significant. That's why it's such a critical area of study in sports medicine. Okay, so to really understand just how big of a deal this is, we need to look at the numbers. Let's shift gears from just talking about the pain to looking at the cold, hard data and see how common this condition really is. Now, what's really striking about this slide is the massive range. You see it right there. Studies show that in at-risk groups, the rate of shin splints is anywhere from 4% all the way up to 35%. That wide gap is a key piece of the puzzle. It tells us that even though the condition is common, its frequency depends heavily on specific factors. A 35% rate, that means for some groups, this injury is almost an expected part of what they do. So, when you look at this list, you can see the data isn't random. There's a very clear pattern here. The common thread connecting runners, dancers, gymnasts, and military personnel is the high volume of repetitive impact and stress on their lower legs. That is our primary causal link. And let's get the terminology right because it's crucial. The medical term is Medial Tibial Stress Syndrome, or MTSS. It's not just jargon. Using the right name allows for precise diagnosis and helps track data consistently across all the research. The name itself is a data point. It's stress-induced pain located on the medial, or inner side of the tibia. So the most important thing to understand is that MTSS is what's known as an overload injury. The question is, what variables contribute to that overload? Well, research consistently points to these 4 key factors. You can think of them as inputs in an equation for injury risk. A sudden jump in training, the hardness of the surface you're on, your gear wearing out, and your own personal biomechanics. But here's where things get really serious. Not all pain in your lower leg is MTSS. And it's absolutely critical to tell it apart from another condition that has similar symptoms because the treatments and the potential consequences are worlds apart. This is exactly why a data-driven approach is so important. Figuring out what's what isn't just some academic exercise. Getting the diagnosis right dictates your entire recovery plan, and it can help you avoid much more severe and sometimes permanent complications.
And this table right here is our diagnostic cheat sheet. Let's break down the data. For MTSS, or shin splints, the pain is right there on the bone itself. For CECS, it's a deeper pain, inside the muscle. Next, look at the timing. MTSS pain often hangs around after you stop, while CECS pain is like a switch. It turns on when you exercise and off when you rest. And finally, the type of pain. MTSS is that dull, throbbing ache. But if you're feeling burning, cramping, or numbness, that points towards CECS and suggests nerves or blood vessels might be involved. Every single cell in this table is a critical piece of diagnostic data.
Okay, so let's say you've got an accurate diagnosis of MTSS. What does the science say you should do next? Let's walk through the evidence-based protocol for getting you back in the game safely. The first thing you'll see recommended in countless studies is the RICE method. This isn't just some old folk wisdom. Each step is a targeted physiological intervention. Rest unloads the tissue that's under stress. Ice constricts blood vessels to reduce swelling. Compression adds external pressure to limit fluid buildup. And elevation uses gravity to help drain that fluid away. It's a systematic approach to handling that initial acute inflammation.
And here is a crucial number that comes straight from clinical data on how our bodies heal: 3 to 6 weeks. This is not some arbitrary waiting game. It represents the typical biological timeline for the inflammation and tiny traumas in the bone and tissues to actually resolve. Re-injury statistics are very clear on this. Trying to come back before this window closes is one of the main reasons an acute problem turns into a chronic one.
Now let's circle back to that initial puzzle about the shoes and look at another hard number. Lab tests on running shoes, especially that foam in the midsole, show a significant drop in shock absorption after about 500 to 800 kilometers of use. The material literally gets packed out. So tracking the mileage on your shoes isn't just a nerdy suggestion. It's a data-driven maintenance schedule for your most important piece of gear.
But just resting and waiting is only half the battle. The data overwhelmingly shows that a proactive strengthening program is absolutely essential if you want to prevent this from happening again. So let's look at the evidence for building a more resilient system.
So these exercises aren't just picked at random. They're prescribed based on biomechanics. Calf raises build up your calf muscles so they can absorb more of the landing force. Toe raises strengthen the opposing muscle on the front of your shin to help control your foot. And the glute and core work? That's about making sure your whole system is stable. Gait analysis shows that a stable pelvis prevents all sorts of wonky compensations that overload your lower legs.
And if you're wondering, hey, where does this advice even come from? Well, this flowchart is a great visual. It shows the rigorous process behind these recommendations. This isn't just guesswork. Researchers use controlled trials and systematic reviews to figure out which interventions actually deliver measurable results. It's all about making sure the advice is based on solid evidence.
Finally, let's put it all together with 3 evidence-based training principles. First, you've got the 10% rule, a widely accepted guideline for managing your training load. Second, cross-training, which lets you maintain fitness while giving your shins a break. And third, form. Gait analysis clearly shows that overstriding massively increases the shock to your tibia. These aren't just tips, they are variables you can control to lower your risk of getting injured again.
So we end with this question. After everything we've looked at, the entire body of evidence points to one conclusion. Pain is not just noise, it's data. It is a clear signal that a specific system is overloaded. The goal shouldn't be to just silence that signal, but to decode it. Is the problem your gear, your training volume, your biomechanics? Applying an analytical mindset to that signal is the real key to moving beyond just recovery and towards long-term sustainable performance.